we do expect a rise in tick-borne disease in general, including Lyme disease. Beyond Lyme disease, there are a lot of other diseases, tick-borne diseases that are significantly in causing human diseases or slowly creeping into the northeastern part of the United States, particularly in the New York State. That is one thing, is that the increasing number of ticks, increasing different ticks that are being exploded that have the capability to transmit different pathogens. As far as the tick-borne diseases are concerned, most of the febrile illnesses start with flu-like illness and then followed by fatigue. And I think if you're exposed to tick, if you know that if you're exposed to tick and then if you get sick, if you get flu-like illness, it is important to go to a healthcare provider and tell them that they were exposed to a tick and they can do appropriate diagnostic tests. The use of the 20 to 30% DEET insect repellent is probably the best way to prevent from getting tick bites. The CDC recommend is to use DEET-treated products like clothing material when you're gardening or doing hiking or doing outdoor activities, to use chemical-treated outdoor wears. That is one way to prevent yourself. Or apply, what I would recommend is to apply to your socks and shoes a good amount of DEET or lemon eucalyptus based insect repellents that it kind of repels the ticks attaching to you. I always say when you're going on a hiking trail, try to stay in the middle of the hiking trail rather than try to be to the corner of the trail where you are so close to the grass patches. That's where the ticks will be questing there. They will be like hanging right at the tip of the grass. They will be waiting for the human to come across and then they latch on you. So if you can try to avoid walking so close to the grass path is good. So I always advise my kids to go right in the middle of the trails so that they are protected from any tick bites. And it's very important to actually check every day when you're outdoor. Check every day for the, if any tick is attached on you. And then depending on the size of the tick, you can tell from the size of the tick, is it actually been attached on you for a long time or shorter duration? So if you are able to find a tick in your body and remove it within the first 24 hours, there's a greater chance that you will not have Lyme disease transmission.